Medical experts in South Africa have welcomed the government's plans to provide antiretroviral drugs to all those living with HIV/AIDS. Until now, the drugs have been restricted to those in the later stages of the infection, but under the new plan, millions more will now receive the drugs far earlier. CCTV's Julie Shire has that story.
About 3.2 million HIV-positive South Africans take these life-saving drugs every day. Antiretrovirals suppress the virus and maintain a healthy level of white blood cells. Until now, the State Health Service gave them only to patients whose immunity system had weakened to a certain level, defined by a so-called CD count. From all HIV/AIDS patients will receive ARVs.
We have been waiting for this since we started rolling out ARVs. ARVs are life-saving. At this moment, there is nothing else that will save a person's life who has HIV. It is better for you to be on treatment earlier rather than waiting till you're sick. So with this strategy, we will hopefully avoid having patients or people who are sick before they start ARVs. This will decrease the complication rates as well. So this is very positive and it's a very welcome move. We are very happy.
I think it's quite a profound announcement for the country in terms of its HIV and AIDS program, at least for South Africa, where we have an estimated number of about 6 million people infected. It's critical that we aim to, as the WHO has recommended, to eradicate AIDS and HIV by 2030. With this particular announcement that has been made by the Minister of Health also means that there must be more focused testing to really ensure that those individuals that are HIV infected are identified, are put on treatment where appropriate and monitored effectively.
South Africa runs the world's largest free treatment program for HIV/AIDS. The policy change will have an additional cost on the healthcare system, around $66 million this year alone. But the government is convinced it will improve quality of life for those living with HIV/AIDS and help cut the level of new infections. Julie Shire, CCTV in Johannesburg, South Africa.